Guys, so in this video let's talk about Sjogren syndrome. So Sjogren syndrome is an autoimmune disorder which is usually associated with other autoimmune conditions such as rheumatoid arthritis, systemic lupus erythematosus and scleroderma. So this condition affects the patient's exocrine glands. So the main exocrine glands are parotid and lacrimal glands. So as you can see here are the lacrimal glands next to your eyes, and these are the parotid glands. So parotid glands release saliva and lacrimal glands release tears. Alright, so since these glands are affected, they are not able to produce much of saliva or tears. So less saliva leads to dry mouth, and dry mouth eventually leads to difficulty swallowing because you need some lubrication when you're swallowing, right? And then the less tears cause dry eyes, which is similar to sandy feeling. So when your skin, for example, on your face is dry, you get this sandy feeling, right? So that's what you get under your eyes because of the dryness. So this is also called keratoconjunctivitis sicca. So sicca also, you can remember sicca with the term sukha, which in Hindi means dry. So keratoconjunctivitis sicca is nothing but dry eyes. Alright, so you'll also have enlargement of parotid and lacrimal glands because the glands are not able to release the fluids outside, right? The secretions outside. So all those secretions are developing inside, they are building up, which leads to swelling. Alright, so we can see in this image how the patient has all dry eyes, and here you can see all these cracks on the patient's tongue, that is dry mouth. Alright, so the investigations we do, the first thing that you have to know is anti-Rho and anti-La antibodies. So you can just remember, again this is for the Hindi guys, Rho-La means Rulana, right? So Rulana is to make somebody cry. So since here in this autoimmune disorder, the patient is not able to cry. There is no cry, therefore the antibodies are Rho-La, okay? And another thing that is very specific to this diagnosis is Schirmer's test, which is, you can remember it as swimmer's test or swimmer, because there is again no water. So the patient at least tries to go and swim because there is some water there. Alright. So Schirmer's test is nothing but there is decreased tear production again because the patient's lacrimal glands are being affected. So therefore there are no tears. Another test that is done in this condition is Bengal rose water test. So again, you can remember with the term rose water because the patient doesn't have water in her body. She's trying to get that from other sources. Alright. Rheumatoid factor is positive, which is seen in almost, and ANA positive. These two are very non-specific antibodies seen in almost all autoimmune conditions. Alright. And management is artificial tears and artificial saliva. Alright, because the patient doesn't have tears or saliva, so the patient has to keep herself hydrate and get some artificial tears. So those artificial tears, hypromelose drops. So that is a type of eye drop which causes lubrication in the patient's eyes. Alright, and artificial saliva. That's all about Sjogren's. Thank you.